Hi, everybody. Susan and Irina here. And today we're going to talk about digital twins. It's a term that we've kind of heard quite a bit lately, and we thought let's look at it and see what it means, what it does mean, and what it means for nursing. So, Irina, what is digital twins?
Yeah, I literally have to read you the definition because I think there's so much fear, but also so much excitement. I don't want to get it wrong. But digital twin is a virtual dynamic representation of a real world system, like a patient, a device, or even an entire hospital. Susan, when was historically the first time that we as humanity, or maybe we as Americans, um, utilize digital twin without having that name?
Yeah, interesting. It happened for with Apollo 13. If people remember, they had a problem with their computers up there, and they were unable to come back safely. And so, what NASA did, what their engineers did, is they actually built a replication of what was up there. And through trial and error, they kind of did things so that, but keeping with the safety of the crew that was there. So if they created something or made an intervention that didn't go well with the digital twin, obviously they would not tell the crew to implement that. Ultimately, the crew was able to come back safely. And so even though it wasn't named digital twin, it was probably the first time that that kind of concept was, brought to light.
Yeah, and it almost like to me, if I didn't know more about it, it almost sounds like what nurses know very well, which is the simulation labs,
Sure.
where we being taught how to put an IV, talk to the patient, do the dressing change. So in your mind, like how is it different than simulate? Because to me, it was almost like a simulation lab, but there's a twist.
Yeah, so a simulation, so you think about digital twins as I think about it's a mirror image of whatever it is. Okay. So if you have a simulation and you have your script, so that's you're going to mirror that. However, now with digital twins, if a student gives a different response, that digital twin will respond differently in the scenario. So it could, it really kind of ups the ante with the what ifs, right?
Right.
And helps with competency-based education and progression for the student. So I think it really increases the level of knowledge that students would be exposed to in these kind of it's almost like an unfolding case, but in real time, and it's really a great predictor of of what the nurse's actions will do.
Yeah. And I think that maybe the kind of the word that I want to underline or the kicker is like the real world system
Yeah,
and it's real time data.
yeah,
Because I remember, we just did in a nursing school a simulation where a patient came in, oh, actually, it was a fake doctor that came in and talked aggressively to the nurse, but that doctor had a script.
yeah,
And the doctor couldn't really stay off script. So
right.
even if the student gave a very, I think, one of the students actually cried. Even if the student did it, kind of took a U-turn, that doctor couldn't
No,
take the U-turn because they had to stick to the script. Where in digital twin, it would literally be like real time, real world
absolutely.
scenarios,
Yeah,
right?
yeah.
And I can say, like, I know it's a huge right now. It's huge in pharmaceutical because they're actually testing medications on people's genes. It's huge in oncology. Um, like, where else is it right now that you can
Yeah.
hear of that it's
Yeah,
taking place?
I mean, I think they're trying to use it for like staffing patterns, make a digital twin of your ICU or your ER. And what are the peak times? What are the busy times? And then look at that workflow and anticipate and predict what your staffing needs will be, what your staffing patterns will be, the level of staffing as far as, the number of RNs versus physicians versus, patient care techs, whatever. So, I mean, I think, and again, like you said, this is all in real time. Um,
Yeah,
and
yeah.
so that it really allows, I think it's going to be, allows for much more efficient use of resources in that kind of using it for staffing and models like that.
Yeah, yeah. And I hear a lot from the physician colleagues of mine where they're building digital twins of their knowledge. They're
Yeah.
putting all of their knowledge, everything, like all of the notes that they wrote, the articles that they read, everything. And then what they're predicting in the future is that if a ER doc needs a consult in the middle of the night from nephrologist or oncologist, the digital twins can actually talk to each other, look at the records, start with things that are like, these are the labs that I need. Because, waking somebody up at 3 o'clock in the morning just to say, I always get this and this and this and this done before I see patient. Why not have it done now? So that, better decisions could be made, a little later time. And one of our faculty in ABAIM, Dr. Harvey Castro, built his own digital twins using all of his biometrical data. So I'm not sure exactly what he was using, the watch, the Meta glasses, the blood pressures, like everything. And on LinkedIn, again, we'll link the show notes. He said that he lost tremendous amount of weight because he was able to, I think he said, exercise differently, eat something differently. So you can test that on a digital twin and then implement it in your life.
Yeah.
And this is where, Susan, like, I would love to at some point build a digital twin for myself and like test different diets, because, there's, everything from Mediterranean to, keto, and I don't know how it's going to react to me.
Right. So I think not only for you, but I think for many people who, are looking for weight loss, diets or exercise or wellness, anything like that. If they knew what would work right in the beginning,
I know.
it would be so helpful and less frustrating to find, oh, let me find what works for me, when if it could be tested on your digital twin and implement it quite readily with really positive effects, I think is going to be outstanding.
Outstanding. I think a few years ago, it was like a sci-fi. Now I see people actually doing it. So I was like, wow, this is real.
And it's
And I think
working.
in a few years, a lot of us are going to be actually using it.
Yeah, I think physicians are going to be using it on their patients so that they can implement the right kind of interventions.
Yeah.
And nurses as well. What's that care plan look like for that? Really, when we talk about individualized nursing care plan, I think, boy, using it on a digital twin is going to be remarkable.
Fantastic. All right. So guys, stay tuned. More to come. And we'll probably do a few more just on digital twins, but more articles to come your way.
All right. Remember, visit us on www.nursesforai.org. See you soon.
Bye.
Goodbye.